Good morning, all my East Coast friends. This is John Molinari, coming from Central Coast, California, where we're not quite in quarantine, but despite the beautiful weather, people aren't moving around very much. Thank you for listening to this. I was really looking forward to coming to give the Concord seminars on the 7th and 8th of August, but as you know, with the pandemic, travel is very limited, and groups are just not getting together. Anyway, so we're doing it virtually. I was asked to give you a very brief update as to what we're going to be doing on the 7th and 8th. We're scheduled for infection control, a discussion on vaccines, and then waterborne infections. Obviously, this was planned very nicely, I thought, by Concord back in March when this was all scheduled. But with the COVID-19, SARS-CoV-2 pandemic, things have been changed. Just to update you a little bit as to what I'll be covering in these webinars is I intend to begin with a brief update on COVID-19 and SARS-CoV-2. So you're updated not only on the terrible status of the pandemic, a little bit about the virus as to why we are in the situation that we're in. And then as we get into the infection control portion of the seminar, I've updated a lot of information on some of the newer infection control recommendations and regulations regarding airborne infections, transmission precautions that we're being asked to take, N95s, air ventilation. All of that has been updated, and I've been working on this continuously since the pandemic began with colleagues and groups, etc. That will include all of that in the infection control section. Then when we get into vaccines, in addition to talking about public health importance and very specific vaccines for you as healthcare workers and your children, and the current state of vaccination, I'm including a whole section on the development of the COVID-19 vaccine. As you know, the work is going very rapidly, and looking to make sure that things are done well. But I want to update you on exactly what is going on, what needs to be going on, what has to happen before we have an acceptable vaccine, so you understand as best as possible all of the ramifications and information when it comes out, whenever that is. The last section is on waterborne infections with a focus on dental water lines. Despite all of the issues and problems with COVID-19, we still have other areas of infection control that need to be addressed. And this is one of them where there's a lot of confusion still. And so in addition to talking about some of the organisms that can create problems, we'll talk about some of the healthcare issues in hospitals and dentistry, and then go through very specific information about how you can help improve your infection control for your dental water lines. That should take us up through the end of the day, at which time, hopefully you won't be too tired to be around, and I'll be certainly available for questions throughout the whole thing. But I look forward to seeing you. If you have something on the 7th and 8th of August now, because of virtual seminars, I will be doing the same thing on the 14th and 15th. So you can sign up for one of those as well. Thank you very much for your time, and I look forward to talking with you on the 7th and 8th of August.